Imagine a compound so powerful and mysterious that it's been nicknamed the Wolverine peptide, a nod to the Marvel superhero renowned for his incredible healing powers. From underground biohacking communities to the highest echelons of elite athletics, whispers about BPC-157 have grown into roars. Supporters claim it can heal torn muscles, regenerate nerves, and even protect the brain from damage. But with all its potential comes a critical question. Is BPC-157 a revolutionary leap forward in regenerative medicine, or a biohazard cloaked in hype? In this video, we'll explore what BPC-157 is, the science behind it, the potential risks, its legal status, and whether this miracle molecule is truly the game-changer it's claimed to be, or a dangerous experiment in progress. Let's dive into the reality behind the headlines and separate solid science from seductive speculation. To understand the buzz, we must first break down what BPC-157 actually is. Short for Body Protection Compound 157, BPC-157 is a synthetic peptide made up of 15 amino acids. It was derived from a protective protein found in human gastric juice, where it naturally helps to protect and repair the lining of the gastrointestinal tract. This link to human biology is part of what makes BPC-157 so interesting. It wasn't just invented in a lab from thin air. Rather, it's a refined version of a naturally occurring substance already involved in healing and protection. What truly sets BPC-157 apart is its supposed ability to heal not just the gut, but tissues throughout the body. Early experiments suggest it might help regenerate muscles, tendons, ligaments, and even nerves. It's also been reported to reduce inflammation, accelerate angiogenesis, the growth of new blood vessels, and even protect internal organs. Taken together, these effects position BPC-157 as a potential all-in-one therapeutic agent, something the medical world has long sought but rarely found. Most of what we know about BPC-157 comes from preclinical studies, research conducted in lab animals rather than humans. These studies have shown that the peptide has an unusually broad range of healing properties. For instance, in rat models, BPC-157 has been observed to accelerate the healing of Achilles tendon injuries and torn quadriceps. In other studies, it appeared to protect the gastrointestinal tract from damage caused by NSAIDs, a class of drugs known to irritate the stomach lining. Another fascinating effect is its impact on the nervous system. Animal studies have suggested BPC-157 may encourage the repair of damaged neurons and even promote functional recovery after spinal cord injuries. While these results are astonishing, it's important to emphasize that they have not yet been conclusively replicated in human trials. Anecdotal evidence from athletes and fitness enthusiasts points to rapid recovery from sports injuries, reduced joint pain, and even cognitive enhancement. However, while these personal stories are compelling, they don't carry the same weight as controlled clinical trials. Science moves cautiously, and for good reason. Here's where the optimism begins to waver. Human studies on BPC-157 are almost non-existent. While numerous rat and mouse models suggest dramatic healing effects, these findings cannot simply be extrapolated to humans without rigorous, controlled testing. The few preliminary human trials that have taken place are limited in scale, and their results have not been published in major medical journals or undergone peer review. This lack of robust clinical data presents a serious issue. In medicine, safety and efficacy must be demonstrated through randomized, double-blind, placebo-controlled trials before a compound can be deemed reliable. Without this gold standard of proof, all claims remain speculative, no matter how exciting they sound. Yet despite this absence of concrete data, BPC-157 has gained a strong following in biohacking circles. Online forums are filled with glowing reviews from users who claim life-changing results. However, without proper oversight, it's impossible to know whether these testimonials are due to the compound itself, a placebo effect, or a combination of both. As with any compound that affects fundamental biological processes, the potential for unintended consequences cannot be ignored. BPC-157 promotes angiogenesis, an essential part of healing, but also a double-edged sword. While new blood vessel growth helps regenerate tissues, it can also feed the growth of tumors. In theory, a compound that stimulates angiogenesis might accelerate cancer progression in those predisposed or already affected, though this has not been proven. Another concern is hormonal disruption. By enhancing growth hormone receptor activity and influencing other biological pathways, BPC-157 could throw the body's natural hormone balance off course. This could lead to unpredictable long-term consequences, particularly with repeated or high-dose usage. Then there's the issue of administration. Since BPC-157 is not approved for human use by the FDA or most global health authorities, it's not available through regulated pharmaceutical channels. Instead, people obtain it through research chemical suppliers or underground labs, sources with little to no quality control. Add to that the risk of allergic reactions, injection site infections, and unknown interactions with other supplements or medications, and the picture becomes much murkier. Without clinical trials and long-term data, we simply don't know what the risks are or how to mitigate them. As of now, BPC-157 exists in a gray area. It is not classified as a controlled substance, but neither is it approved as a therapeutic drug. In the United States, the FDA has issued warnings against its use and marketing for human consumption. Other countries vary, some ban it outright, while others allow limited research. In the world of professional sports, BPC-157 is even more controversial. While it's not currently on the World Anti-Doping Agency's WADA prohibited list, its performance-enhancing potential has raised serious ethical questions. If a compound can speed up recovery and improve physical resilience, does using it constitute cheating? Is it fair to other competitors? And what are the implications for athletes' long-term health? There's also a broader societal question at play. If healing-enhancing compounds like BPC-157 become commonplace, who gets access? Will it only be the wealthy, the connected, the elite? Could it become another factor in widening the health inequality gap? In the digital age, hype spreads faster than data. A single Reddit thread, influencer podcast, or YouTube testimonial can ignite widespread enthusiasm for a substance like BPC-157 before the science catches up. Supplement companies, biohacking gurus, and fringe medical providers often seize on this interest, marketing the peptide as a miracle cure for everything from joint pain to cognitive decline. BPC-157 represents a compelling case study in the intersection of science, health, and hope. Its potential as a healing agent is supported by a strong foundation of animal research and some plausible biological mechanisms. What we need now is not more hype, but more science. Proper clinical trials, peer-reviewed research, and safety studies must come before widespread human use. Only then can we truly assess whether BPC-157 is a breakthrough therapy or a biotech bubble. In the meantime, if you're considering using BPC-157, consult with a licensed healthcare professional. Avoid unregulated products and stay informed about the risks. In a world obsessed with longevity, performance, and self-optimization, it's no surprise that BPC-157 has captured so much attention. It promises faster healing, reduced pain, and even enhanced brain function, an appealing trifecta for athletes, patients, and everyday people alike. But like any new medical frontier, it demands caution, scrutiny, and responsible use. Have you or someone you know tried BPC-157? What was your experience? Share your thoughts in the comments below. And if you found this breakdown helpful, be sure to hit that like button, subscribe to the channel, and turn on notifications for more in-depth explorations into the future of health and science. Stay curious, stay cautious, and stay safe.
That's all, folks.